Hello, good evening, visionaries. Good evening to you all. From wherever you're joining in from, you're all very welcome to our training today. As you all know, Tuesdays are usually products training days. And because we value health so much, we always have doctors that take us through these trainings to equip us with more knowledge about our health and how we can help our health with amazing products that we work with already. Once again, you're very welcome, all the leaders from wherever you're joining in from, everyone, those in Kenya. Personally, I'm in Uganda, and my name's Rina Nasimbwa. I'm only going to be your host. Like I said, we have a doctor who is going to take us through the training today. As you all notice, the topic to this training was shared, and he's going to be taking us through menopause. And whatever that he will be talking about, I believe we all need to listen very carefully to the information that he's going to share with us today, very carefully. Without wasting any more time, ladies and gentlemen, allow me invite on stage a gentleman who has always trained us. Thank you. I want to take this opportunity actually before I invite him to appreciate him for always sparing time for the visionaries to train us, to share his knowledge with us. He's part of this business. I believe most of you know him. He's a gold executive in this business, and he is a part of the International Millionaire Circle member club, and he's been a mentor to so many people in and out of Uganda. He has built a very big team in and out of Uganda, but today, like I said, we're talking about health. So he is a doctor by profession. Ladies and gentlemen, let's join together and welcome Dr. Robert Masaka. You're very welcome, sir.
Yes, thank you very much, Madam Rina, for that wonderful introduction. And for those of you who are seeing me for the first time, the name is Robert, same as Masaka, and hopefully I'm Benav, Madam Rina. Hello?
Hello, yes, sir, you're very hard. We can hear you.
Okay. Thank you very much. And my culture is very simple. I always want to talk to people that I'm seeing. If you don't mind, you can have your video on. If you don't mind, this is an interactive session where it is very, very vital to talk to people that you're seeing. Kachiyabwa, you can see you're there. Judith, you're there. Kaya Chambade, you're there. Angela, you're there. Wow, I love that. Doreen, Diwalu. People are looking nice here. This is an interactive session. Rose, Kenya, you're welcome. I'll only talk to those who have videos on. If your video is off, my knowledge will not come to you. I can see the champions now turning on the cameras. That is wow. It is always very, very vital that we talk when we can see each other. Instead of attending Zoom meetings and then you're not there, some of you even come on and leave your cameras closed and then you go to the kitchen. It is okay. We can even see when you're cooking ugali, when you're cooking, how do they call it in Zimbabwe? Saza. Do I have Zimbabweans here? If you're there, you can say Makadi. So anyway, it's a nice evening, and I want to take this opportunity to thank the Visionaries team. It is out of this world. I can say champion here or team. Champion or team. South Africa, people are coming in. I want to take this opportunity to thank the team. That is the Visionaries team right from the top one, that is Sir Elias Mohos. This is a wonderful session that we always have. And not every team that has come up with such a session where they can extend knowledge to people. You know, it is very good to build business, but if you can belong to a team that can give you knowledge, including medical knowledge for free of charge, you need to just be proud of the team. For those who have put on the videos, Tony or team, Namala, Samuel, you'll excuse me, of very many. If I don't mention your name, but just know I've seen you and I recognize you. And always take this culture as far as your teams. That every time you're doing a Zoom meeting, you put on the videos, see yourselves interact. If the pandemic goes for 100 years, What if they bring COVID-20, COVID-21, COVID-23? When will you see your friend again? Eh? So these are always times that are good for us to see each other. So straight away, I want to be very brief and on point on the topic that I'm going to share today. What I'm going to be sharing with you people today is something to do with menopause and then premenopausal syndrome. And straight away, I want my screen. And hopefully my screen is seen.
Yes, sir, we can see it very clearly.
Oh, okay, thank you. So straight away, for those of you who are seeing me for the first time, my name is Robert Semwezi Masaka. I'm a medical doctor, I'm a nutritionist, and also an entrepreneur. I remember I was talking to one of my business partners. I told her a doctor who turned an entrepreneur, and she was very, very excited that, wow, you turned into an entrepreneur. So what I want to share with you is very simple. It's about menopause and premenopausal syndrome. If you're lady, this is your topic for today. Then the men can always clap for us. Today it is a ladies' day. And I happen to be the director HBMS TV. For those of you who want to have more knowledge, powered by the visionaries, they've given me the knowledge to be in position to share something with you. Always you can go to YouTube and then subscribe to our YouTube channel. It's HBMS TV. You can always get more knowledge about products and testimonies and all that. So straight away, what I'm going to be sharing with you people is what we call menopause. But before we go to that, I wanted to share with you this about life. I wanted to share something about life. Just know that it is a transition. You begin when you're born, you grow, you get to puberty, get to teenage age, then get to advanced age, 30, 40, 50. Then it is a stream whereby you have to go back where you began from by dying. I have a book I was reading and they said the best invasion of life is death. That is the best invasion of life is death. So whether you want it or you don't want it, life, that is the cycle of life and you have to pass on. And then what I want to share with you today is pre and menopausal syndrome. I was sharing with one of my fellow doctors today, and she was like, since when did the menopause become a syndrome? So I felt it important that I should also tell you what a syndrome is. A syndrome is just a combination of systems that are associated with any condition that come together, it becomes a syndrome. And when we talk about today's session, I want us at least by the end of this session for you to be in position to know what premenopausal syndrome and menopause and then menopause are. And the question that people always ask is menopause a disease or a time when men pause? Because every time ladies get to menopause, they don't feel like they want the men again. They feel like they can stay alone and all that. So is it time that men pause or it is a disease? But we will be answering all that question by the end of the session. Then number two, we need to look at the signs and symptoms of both the pre and then the menopause. One thing you need to know, menopause is something that is natural, that happens. It is life, part of life. Then we need to know the causes of premenopausal syndrome. Then we need also to know the risk factors of premenopausal syndrome. Then we also need to know complications that are related to premenopausal syndrome. Then we need to look at the non and pharmacological measures. However, for today, our focus will be on the non-pharmacological. But yes, there are also pharmacological measures where I use pharmaceuticals and all that, and drugs and hormones and what have you. But for today, we are looking at the non-pharmacological. Then the other one, we need to know the role of proper diet in menopause, or prevention, or fighting menopause, or fighting premenopause. And now, as we talk about premenopause and menopause, I want to bring you to your notice that menopause is a permanent cessation of menstruation. for 1 year. Actually, they tell us for 1 year after the period of, for 1 year after the age of 40 years and above. Permanent cessation, you can't see your periods 40 years and above. However, the challenge these days, it is so happening that even people are getting issues at the age of 20, 25, 30, 35, 40. So they say this is as a result of loss of ovarian follicle activity. No eggs are being produced no eggs that are being produced by the ovaries. At times they say your oestrogen levels are also not there, the hormone is down and all that. And they tell us the most important thing that you need to understand very well, it comes naturally to most women. However, there are risk factors when you talk about risk factors that may bring it early. That is where the problem is. It is very natural that you can have it at the age of 40, but again, there are factors that are bringing it at a very, very early stage. That is where the problem is. And they tell us that premenopause is the 5 to 10 years period that begins when a woman starts experiencing menstrual irregularities until the body completely adjusts. And that is the most worrying. And it even puts you at the risk of infertility. Just know if you can't ovulate at the end of the day, it simply means you can't even get pregnant. So you need to understand there's a difference between menopause and there's a difference between premenopause. When we talk about menopause, it is entirely this. Menopause, it is part of life. We go back to this, that at the age of 40, we expect somebody to have gone through life, the normal everything and all that, and then you get back to where the ovulation ceases to completely. But now what happens, the most worrying thing is when it comes in earlier times, it is 5 to 10 years, and that is what we call menopause. And then the other one, I want us to talk about the signs and symptoms, especially of pre or the menopause itself. Pre or the menopause. The most worrying part is the pre, when it comes in earlier. Because at the advanced age, 40 years and above, you are at the 4th floor, it could be very normal, it's nature. But again, when it comes early, these are some of the signs and symptoms that you're going to be looking at. Number 1, hot flashes. Ladies, this is something that you do not want to experience. Hot flashes. This is a tendency where you're going to find you feel a warmth that is beyond your body temperature in your face, in your chest, then in your thighs. Your body temperature goes higher than the body temperature. It is hot flashes. It is something that you wouldn't want to have. Then the other one is depression. Very, very deadly. I've seen young girls at the age of 20, 25, 30 getting into depression. At times they may call it love. At times they may call it hysteric attacks. People are depressed. You can't perform your duties very well and all that. Just know these are some of the signs. I don't say whatever I'm sharing is a conclusive decision to or diagnosis to say somebody has menopause or premenopause. No, this is a cluster of symptoms, a cluster of symptoms that may show you that either you're getting to premenopause or you're already in menopause. Then the other one is insomnia. Insomnia is when you look at the functions of C24/7, I'm sure we have guests here who may have not have heard about C24/7, but the biggest number, if I can have 130 participants, I'm sure the one that know about C24/7. I'm sure most of you have heard about C24/7, preventing and reversing over 100 diseases, including insomnia. That is the 100th condition. Insomnia. Insomnia is just a sleep disorder. It so happens very common in menopause, but again, it can also come in premenopause. I've seen this condition happening in networkers. I don't know why. Networkers don't want to sleep. You're always awake in the night, and then when it's coming to time, then you doze. Then we invite you for soul meeting, you can't turn up. You're having insomnia, sleep disorders. You get to bed, you can't sleep. Then by the time it is coming to morning, that is when sleep comes in. It's a condition that you need to address, but it's also a symptom that may appear in a condition that may appear both in pre and then the menopause part of it. Then backache, always getting backache. This is ladies' food. Out of 10, 8 will complain of this. Yes, however, it is related to excess loss of calcium in your body, calcium leaching and all that. But backache is something that is very common in menopause and premenopause. Are people following? I need to say yes there. I need questions to keep coming in so that at the end I just answer them and we go. Are people there? Thank you. I'll go on. Then the other one is dyspeleunia. Dyspeleunia. Pain around the parts, the vagina around that area, dyspeleunia. Then the other one is mood swings. Ladies, are we there? Tell me yes if you're there. Just put a yes in the comment section. Mood swings. You're laughing, and then 1 hour from now, you're very annoyed with your hubby. You don't want him to touch you and all that. Then heart attacks are also common when menopause sets in or premenopause. Then incontinence on cough. Ladies, when you're in your menopause, at times you're coughing, and then you have urine coming out. Incontinence. At times it even goes as far as the urinary incontinence, the blood incontinence, and then the bowel incontinence. People are advanced in age. I'm sure some of you have taken care of old ladies. You find them having it difficult to control their bowel. They can pass out poo-poo when they cough and all that. Then the other one is frequent urination. You're urinating again and again, again and again. Then the other one is no messes at all. At times you can keep seeing them or you miss them. You see them, you miss them. You see them, you miss them. No messes at times at a tender age. But again, when it is advanced age, 4th floor and above, completely. Then vaginal dryness. Every time you're experiencing this, to the ladies in Uganda, you know, the dry ones, ladies, it is a very, very challenging condition and situation. And by the end of today, I'll give a solution to that, such that you don't have it. Because the moment you're having it, you're advancing to premenopause and then the menopause itself. Then loss of libido. Loss of libido, I'll marry it with the mood swings. People don't want. You reach a time when you don't want. Number one, you're dry. You're like, if a man engages you, is causing you bruises. However, when it also comes to us men, it is an issue for ladies who are dry. We do not want such. So loss of libido, if you're dry, then you have mood swings, then you have pain, then you have depression. At the end of the day, you end up not wanting. You don't want to have sex and all that. Then anxiety. Then talk about urinary incontinence, passing out urine unknowingly. All these are signs and symptoms. I don't say that this is a conclusive diagnosis, that the moment you have this, you have premenopause or you have menopause. No. For those of you who want to have more knowledge, you'll go and subscribe to our HBMS TV on YouTube, and then you can have all these. These programs are going to be recorded, and you can always meet them on that TV on YouTube and follow through. Then, let's talk about the causes, especially premenopause. Menopause, we've seen it's natural at the age of 40. You're there. You can have cessation of the periods and you cannot see them again. I remember there is a time I had a lady at 52 getting her periods again. Last time I had a lady at the age of 48 having them again. That is the status of these products that we have here. Our products have a lot of power, but we are looking at the causes, especially the premenopause. Number one is lifestyle. If you're led and you're there, watch your lifestyle. Yes, the more we've copped to the Western culture, everything is spoiled. Everything is spoiled. Everything is spoiled. Lifestyle. I've seen us ladies do alcohol. People even go an extra mile to take alcohol while they are pregnant, which is very, very deadly. I would advise you die with it. Ladies, you go sit in a dryer for over how many hours? They are boiling you a metal lifestyle. Then you go into a salon, you put your bare head. Somebody who is working on you is putting on gloves, and you're putting your bare head a metal. They're all issues, lifestyle. Boozing and everything, alcohol. All those things at the end of the day, they can get you into premenopause, menopause into a very early stage. Then the other one is diet. Can all of you say diet? Ladies, Diet, just type in the section there, diet. Chips, chaps, burgers, what else? Those C's, chicken. They are making your body acidic, and at the end of the day, you're vaginally dry, your body is acidic, you're putting yourself at the risk of cancer. Then menopause out of the blue is also going to come around there. And then at the end of the day, I don't want to talk about the issue of you missing food, missing, I don't know who brought the issue of missing meals in the name of busy. You will watch that these days very many people are doing one meal. We do not have money, we end up doing one meal, then we name it being busy. Am I talking to somebody? A lady, you're supposed to do breakfast, a heavy breakfast, you do lunch, you do light supper, and then you keep your body good. Diet is a very, very important thing that you need to consider if you want to grow very well. But also you need to have a balanced diet. If your diet is not balanced, at the end of the day, you're bringing in premenopause. Then drug abuse. You have ladies here who do it. Ladies, anyone? Drug abuse is an issue. Then abortion. Obviously, when you tend to do abortion, sorry for our young girls who are getting teenage pregnancy, it is an issue that also goes and affects your ovaries, it affects your follicles, it affects your rate of producing eggs and all that. Then it goes, when we talk about abortion, it goes hand in hand with pregnancy. All these affect your hormones and everything. Then multiple pregnancy. If you've had multiple pregnancy, in Uganda, we call them nalonge, multiple, you give birth to 2, 3, it can put you at risk of developing premenopause at a very tender stage. Then pelvic radiation, cancer, cervical cancer, cancer around the pelvis, then you go for radiation. It can also bring about premenopause where you seize your menses, you can't ovulate and all that. Then premature ovaries, last time I told you diseases don't read books, the ovaries can fail to grow. Then failure of the ovaries, then surgical removal of ovaries, then infection of ovaries. Ladies, you need to watch your hygiene. Yes, every time you sit down, you squat down to urinate, there are things that you pick because of your openness down there. But again, if you always have infections and you're doing nothing about them, they are going to descend as far as the ovaries, as far as the tubes and all that, the fallopian tubes. And continuously you have infections, you're putting your risk at developing, your risk of developing premenopause or the menopause period will be dangerous to you. If you're this lady who always have a foul smell vaginally, just know there is a problem, and you can also set to premenopause early, or even menopause become challenging to your side. Infections, every time you remove your pant, it is stained, go for a checkup. Every time you find you have a foul smell, the urine you're passing out is smelly. Every time you have a sexual intercourse, you find yourself with your hubby, you have that foul smell, you need to do something about it. Then the other one is age. Age is natural. The other cycle that I showed you at the beginning, at the age of 40, 50 and above, it's okay. Let it come in, but you need to do something about it. Then the risk factors, these ones you've already seen them, and it is what I've been talking about. I just wanted to summarize it here. Processed food, chips, chaps, burgers. The moment you're doing this again and again, it is okay to do them once in a while, but not all the time. As a lady, do natural foods, cook, boil foods, do natural foods, don't fly, boil and then eat. Then medicinal side effects, when it comes to issues to do with pharmaceuticals, talk about family planning, talk about air pollution, talk about water pollution, unhealthy lifestyle, stress and all that. And then these are conditions that are associated with menopause and then the premenopause. Number one, is cataracts. Ladies, it is very common. As long as your hormones are not all regulated very well, you're going to have issues with your sight. It goes with the refractive errors. You can't see clearly. Then the other one is brain damage. No wonder these days there is a high rate of ladies going insane than men. Gone are the days when men simply because used to have work stress work, they're stressed by work, they could have brain damage and all that, a lot of thinking and everything. Men, are you there? This is only the topic we have here in today's topic if you're not married. So then talk about brain damage in ladies. You have dementia, you have depression, you have insomnia, you have what? You end up being affected in one or the other. Then back pain, ladies. This is a game that you always play every time a lady comes in. Doctor, I have back pain. Doctor, I have this. Then neck pain, then osteoarthritis, inflammation of the joints and all that. Then infertility is in red. For reason, it is the moment you always have issues with the ovulation. There's no way you're going to get pregnant. But at the end of the day, no baby. And that is something that worries ladies so much. Then diabetes, depression, dementia, hypertension, wearing out of muscles and hair loss. They are common in the advanced age. All these were secondary to menopause. And then now the most important thing as I come to the end of my sharing is the non and pharmacological measures to handle menopause. Number one, if you're a member and you're talking to a prospect, you're talking to a friend, you are a guest today, be in position to educate them that menopause is natural. It only becomes dangerous when it is pre-menopause. Patient education and counseling, you need to counsel them. Yes, you need to give them wonderful products that I'm going to be sharing with you. But again, do something about to tell them and help them. Then the other one is in 5 minutes I'll be ending. Then eating nutritious diet low in cholesterol and saturated fats. And cholesterol, if you want to reduce cholesterol, you know better. Reduce omega-3 fish oil, supreme. Reduce the cholesterol. Yes, by coincidence, you may find you can't have your cholesterol levels down. Do it. The moment your cholesterol levels are high, you're putting yourself at risk of developing premenopause. People who are below 40 years, then eat diet rich in calcium, dairy products, and then green vegetables. Then regular exercises, walking and lifting light weights. Don't go and lift heavy weights, just lift light ones. Regularly do exercises, even if it means walking for 30 minutes a day, it is very healthy. Don't die an early death in the name of being busy. Create 30 minutes for your time, work out before showering, skip a rope, do exercises. Then the other one is avoid the trigger factors. You need to avoid the trigger factors for hot flashes. One of the things that are going to bring you hot flashes, number one, is stress. Sorry about that. Stress. Then spiced foods, then caffeine, and then the warm temperature. Ladies, type in the comment section, stop bathing warm water. Ladies, are you there? Stop bathing warm water. Naturally, when you're using this water, even your natural warmth goes. Let me tell you that. Ladies, stop bathing warm water. Last time I was sharing this topic with people who are in the countries where there is winter, and they're like, in winter, it's very hard to use cold water. No, you can boil water, put it aside, and then shower yourself, not the hot water. That is why men have gone on to chase away some ladies simply because you've lost your natural warmth. Ladies are supposed to be naturally warm, but the more you're using warm water, it becomes a problem. Then make vitamin E part of you. When I say this, you know where to get it. Cholesterol, all our products have vitamin E. However, cholesterol has the highest concentration. Then the other one is avoid vaginal dryness. How do you avoid it? I'm going to show you. Make sure you make your body alkaline. Whether you want or you don't want, make your body alkaline. The moment your body is alkaline, your vagina, you can be watery, you can do that, you can be in the tropics, they call them the tropics, not Kalahari deserts, so make your body alkaline with our wonderful beverages. Then the other one is, if you don't want this to happen, don't overuse your private parts as it may lead to dysphonia. Ladies, don't overuse here and there. Even there is a study that has shown that ladies who keep changing men, especially when you're having unprotected sex, it puts you at risk of cervical cancer. You sleep with this one, you sleep with this one, you sleep with this one, you sleep with this one. Even the other cause is men who are not your size, whereby the gentleman goes as far as the cervix. There is that tingling pain that you get the moment the man is not your size and all that. Then for pharmacological measures, talk to your doctor or physician for advice. Prevention is better than cure. And lastly, I want to bring it to your notice that here is the answer. You want your body to be alkaline, or do a 40 days complete detoxification and total cleansing of the body. Always, you're an adult 18 years and above, below the age of 40, before the age of 40, you're ready. This should be part of you. And I always advise people, you either do cappuccino or sugar-free, then add on to 1 box of Coledus, then add on 2 boxes of complete phytoenergizer, and this once in 3 months for anyone with chronic conditions, or once in 6 months for anyone who is normal. You need to look good, live longer and strong forever. These things, the products are supposed to make your body alkaline. They give you the vitamin E, they balance the hormones, they do what? Even people have got their periods ceased. I've seen them get them back, cutters of these products here. So the way you to use them is very simple. With Coledus, 1 times 1 with lukewarm water. Complete, do it in a loading dose. 1 times 1 first week, 1 times 2 second week, and 1 times 3 third week. And then the sugar-free or the latte, you can do 1 times 2. That is for people who are below 40 years. Then 40 years and above, look on your right or your left on your screen. I don't know if you're having a laptop and a phone, I don't know which side, but you need to fight complications that come with age. And when you look at this, menopause at the age of 40 does come with age, it is natural. So you can do sugar-free 4 boxes, Restore Life for 1 packet at bedtime, you do it for 30 days, then C24/7 in a loading dose. And for those of you who want to have more knowledge about this, cutters of the Visionaries team, I always allow you, get to YouTube, look for HBMS TV, subscribe, then put on the notification such that every time you update something, there are a lot of testimonies there. You can always get the education, but you can also check us on our website, www.hbmsinternational.org. Thank you very much for listening to me, and back to you, Madam Rina, so that we can answer the questions. Thank you.
Wow, that has really been an amazing training over there. I have a humble request, Doctor. The moment I'm driving and I'm not in position to read the questions.
And I know the questions are the same.
Yeah, but I've been trying to see the questions here, yes, but I can't concentrate with the driving and reading. So I might request you to kindly help me on that. But that has really been an amazing training. It's something that we really needed as ladies, and for the gents, of course, those that have wives. Yeah, you need to have knowledge so that you probably go back to your wife and educate them or someone. Thank you, Doctor. You may proceed.
Let me check out these questions if I can see them. I can see there are 100 plus, and I'll not answer any question from anyone whose video is not on. I'm only answering those